Pape, Guam, and the Northern Mariana Islands. My name is Tomas Manglona, reporting here on Saipan, and today we're grateful again to be joined by the Commonwealth Healthcare Corporation CEO, Esther Almunia. Esther, how are you doing today?
I'm good. Thank you for asking. Yeah, good. How are you?
Great, thank you. And let's go ahead and just jump right in. I know it's a busy start of the week. We wanted to get right into first about the contact tracing that's currently being done in the CNMI. We know that last night 2 more cases were announced, bringing the case total to about 13. Now, people know that generally that includes family members, associates. Are you able to provide more details on who's doing the contact tracing and what are the status of that right now? In terms of going to the different clusters and maybe different groups?
So CHCC is, as you know, CHCC is the hospital and also the public health department. So we are gathering, staff to basically, in some ways, is a little bit less than an army, but it's necessary to put them out there and ensure that they really make those contacts and trace those contacts to specifically the ones that have been already declared confirmed as positive. So we are sending a team basically out in the community to talk to these people.
And Esther, if I could ask, Guam is mentioning maybe the number of clusters, or they even listed the Hape Bingo, Iglesia and Cristo. Are you able to provide any of that information in terms of locations on Saipan or areas of interest, if you're able to?
Sure. So CHCC was actually the first to identify that there was that cluster. And in fact, still most of the positive cases have been linked to that cluster. And that was shared with Guam, and there is obviously Guam with a bigger population made the connection that it is the same group.
And moving on, we wanted to check in with you about the status of the field hospital. We saw Congressman Kilili Sabalan status of that field hospital on his Instagram yesterday. Can you explain, is that already starting to be used, or what are the plans for the current field hospital on Navy Hill?
So it is to divert a patient surge at our current facility. Right now, CHCC has not, thankfully is not utilizing that, or has no need to use that right away. As you know, the alternate care site is in Kanoa, and that particular area has been designated as the alternate care site. But did we lose it? Sorry.
Oh yeah, we did.
Maybe we should begin again or something. Sorry about that. And let me kind of turn off this because I think it's making noise.
No worries.
No worries too.
Let's just get them right back in.
Yeah, with everybody doing virtual, it's been basically the broadband I heard that it's really difficult.
Oh yeah.
No.
For everybody, actually.
Yeah, even I heard in the States, yeah.
Should be joining us.
Oh, there he is.
Sorry about that, a little bit of a technical difficulty again. We appreciate the patience of our viewers. I wanted to ask you again, sorry, cut out in that last response. So what is the status of the field hospital? You're mentioning that it's not being used right now.
Yes, correct. So, it is a temporary site. It's called the Medical Care and Treatment Site, MCATS. We just, it's basically for the purpose of diverting the patient surge from the current facility. And that's only temporary until the alternate care site, the designated alternate care site of Kanoa, is completed.
Right, and so we saw that news posted on the governor's Facebook page about the alternate care site. Can you explain more? What is going to be the capacity of that care site? And maybe explain a little more too why that's important to have as an alternate care site.
So the FEMA has made recommendation along with HHS recommendations to choose a particular area that already has, the brick and mortar. You have a space, a large space to add beds, and the Kanoa Hotel was selected. Number one, we're already using it as an isolation area, and it's basically for the purpose of adding about 50 ICU beds, and in addition, some medical beds of about 100 more. So it is what they call, that's basically what it means, an alternate care site, meaning another hospital facility. It will be able to have pharmacy services, laboratory services at the same time, a little bit less than what we have now, but at the same time making sure that patients that are specifically for COVID-19 are treated there and have the access to healthcare services that we normally provide here at CHCC as well.
And speaking of providing that care, are you able to share any status about the current COVID confirmed cases? We know last night that those 2 cases you said in that press release are stable. What about the other cases we learned of before last night?
So nine cases have already been confirmed as recovered. And then so the 2 unfortunately have passed, and the other 2 are confirmed as basically active positives right now, and they are in the Kanoa site, isolation site.
All right, thank you for that. And now I wanted to move on to what folks have been talking about since last night, even on Guam, about the 60,000 test kits from South Korea. We got the first shipment, 20,000 of them, just at the beginning of the week. Folks might be a little bit confused about what the test kits necessarily are capable of doing. Can you draw it out for us in layman's terms, in terms of what this provides for the community, these test kits from South Korea?
Sure. So, I guess the uniqueness of our organization is that we have public health and hospital under one roof. And so the purpose of this is really about making sure that we identify, we do surveillance, and we do contain. The idea here is to contain the virus, from transmitting to other people in our population. It is not US FDA approved, as I mentioned to you. It is, however, it is being utilized. It is the accuracy of it is actually pretty, close to 100. I'm sorry. What happened? I'm sorry. Can I go ahead?
Yeah. Sorry. Go ahead.
All right. So the accuracy is big. It's a high number of accuracy. I believe close to 100%. So what in fact, Los Angeles recently bought the same amount of test kits. So it is, they are applying for an EUA, the emergency use authorization. So pending that, for us, for the purpose of public health, for the purpose of protecting our community, we believe that having a population-based testing capacity is necessary for our community, especially a community that is fragile. The healthcare is fragile, and making sure that we have the capacity. This is for us is very, very significant for the CNMI. We want to make sure that these test kits are available also for the island of Luta and Tinian. So we are going to make sure that those things are available. We are going to try to get a community-based testing. However, let me just make that clear, though, and I'm glad you asked that question, is because obviously to have a 60,000 people get tested at the same time is practically impossible to do in a day. So it is going to take some time. It's going to take some time on how we are going to roll it out. However, that's the reason why contact tracing continues. Isolating individuals that have presented already with symptoms, and so there it is going to let me just kind of, I guess, describe it. It's basically collecting. That the way it is collected is the same how we collect it now. Putting them in the VTM, putting them in the collection of the swab, and then putting them in that tube that you basically transport, and making sure that you extract it and then you test it. Those process is similar to what's happening already in Guam. It's the same thing. That's how we, so it's not like, how I would describe it, it's not a pregnancy test. It's not going to be taking a sample and then determining it right away immediately, saying that it can be, we can determine whether you're positive or not. However, again, as the governor had mentioned, our intent is to make it a community-based, population-based, and making sure that people so we can address it quickly and contain the virus as quickly as possible.
And Esther, Guam Public Health Director Linda DeNorsi called into the special report this morning saying that it's not a diagnostic test. And so when these test kits from South Korea eventually roll out to the community, what is that process going to look like? So is it swabs, and are they going to get some sort of indication? Can you lay that out for us?
So yes, it is. Well, because it's not FDA approved, you don't usually use it for the purpose of your clinical care in a CMS facility, right? We are a CMS certified, a Medicare certified facility. So per the regulations of CMS, you need to have an FDA approved equipment to be able to utilize it in your diagnosis and your treatment. And because it is not an FDA approved, US FDA, it is Korea FDA approved, but it is not US FDA approved. And because it does not meet that, our intention is to use all the equipment that have been given the EUA, such as the Gene Expert, ABI 7500, the Abbott machine, the BioFire machines. Those are the equipment that have been given EUA FDA approval. So those equipment will be situated at CHCC also ready. I mean, in fact, they're here already. And that will be utilized to determine the diagnosis and treatment for for the patients that have come to CHCC, the hospital side. On the public health side, we're utilizing the Korean FDA approved test kits for the purpose of surveillance, basically public health activities, including containment of the virus and not having further and widespread transmission.
All right, and so is that just also meaning that the Korean FDA test can show you if the case is likely, and then you're just using that to contain and surveil and not as an official US FDA approved diagnosis? Is that the case then?
Yeah, it's basically identifying. So if it can identify, that's more power to the public health department, right? More power to CHCC to be able to determine that there's that particular case. And again, it's about protecting from further widespread of the virus in our community. And so right now, for example, what we're doing is that once we've identified a case, even before we get the determination of whether or not they're positive or negative, we're already doing the contact tracing. We're already isolating them in the Kanoa resort, or the Kanoa, I'm sorry, not resort, Kanoa ASC, and putting them in, basically protecting our community. So we're doing that now. This testing capability that we just added, or is about to be rolled out probably within a week or two, is basically having that view of your community and who really, it's rather than trying to figure it out afterwards, we want to try to be able to identify the individuals and protect their families and protect everyone, their friends, because not knowing is always a scary thought. And this is for us, it's a better view of our community.
Thank you for that clarification. I wanted to ask about false negatives. Last night we got some comments and some viewer submitted questions about what do we do in the case of an inconclusive case or a false negative. Are you concerned about that? Is the public health department concerned about that at all when these tests roll out?
Sure. So again, for the purpose of, are you talking about the Korean test kits or the FDA?
Yeah, I think yes, the 60,000 from South Korea. Yeah.
So yes, of course. Obviously, if it does come back as positive, we will definitely try to use the test, use the FDA approved testing capability. We're going to be utilizing to confirm that. So rather than, number one, we're not going to get 60,000 test kits for the equipment that we already have that are FDA approved. We already see the supply chain for that. We have the equipment for the BioFire. We have the equipment for everything that we can have, but we don't have the supplies. And so, when you're challenged with that, what does that mean? That means you're limiting your testing capability. And so having these capability basically allows us, again, to identify or, to look at how widespread this, the community transmission is. And, so if we confirm it, if we can confirm everyone, let's say, for example, we have positive cases, of course, we're likely going to validate it with the FDA equipment. And, that's the reason why the pathologist is here to do the quality checks. And, again, we are going to make sure that anything that comes back to us, it will require some quality check. And when the time comes when we actually have adequate supply for the current FDA approved equipment, then that'll be something that we can use and probably, do a quality check on the test kits that have already been done. But right now it's not available. And for us, this is really important because we need to know.
Right, and speaking of the quality check, I also, read, as everyone else did, that there was the pathologist who also flew in from South Korea. Can you explain this pathologist role, how long they'll be on island? What exactly are they doing for us here?
So she will be calibrating the equipment. She'll be making some testings on previous positive cases that have already been determined to ensure that again is calibrated and tested. She will be training our staff how to use the equipment, and she will be basically shadowing the staff and then letting it go for our staff to complete the testing. So she's going to be here for 2 weeks. So it's around that time probably when we're going to be rolling it out.
All right, now I wanted to kind of shift to talking about the US FDA tests. Specifically, are we still sending tests to Guam? And is it still 5 tests a day that they can run for us? And are we sending to Hawaii and California at all? What's the update on that testing?
So what happens, we're sending it still in Guam. Guam is, in fact, as you mentioned, Linda DeNorsi did say that, and she still confirms that with me as well. I appreciate all the, Alan and Linda, they've been really, really helpful. Dr. Thane Hancock as well, making sure that our tests are completed. Yes, it is 5. They look at about 5 every day to test dedicated for CNMI. The other thing too is that yes, we are sending to Honolulu. However, what we're doing is if we have, like, for example, 7, we send it to Guam. Guam makes the determination whether or not it meets the priority, and then sends the ones that are considered not meeting priority 1, not meeting priority 2, are being sent to DLS, and that is to Hawaii. However, I want to emphasize that sending it to DLS is actually pretty fast. The results are pretty fast. As soon as they get it, they process it, and we get it online because we are connected to their network, and that result comes back really, really fast for us as well.
Thank you so much, Esther. To wrap up our conversation, I wanted to ask you, how are the frontline responders at the hospital doing? What are you hearing from doctors, from nurses, from screeners? How are they doing, and what does that day look like for them so far? I know it's been about a month, maybe, right, since we first started with everything.
Well, thank you for asking. The staff are, high spirit, but again, it's always, everybody's worried the same way. They're human too. We want to make sure that we provide them the adequate equipment to ensure also for their protection, and that's one of our top basically is our top priority. You know, in order for them to provide the care for our community, we want to make sure that we provide that for them. So, you know, that's in some ways that's my job, you know, making sure that they have the tools and capability to do the work that they're hired for. And they're really, you know, the same people have been really helping. You know, sometimes it's we're encouraging and urging, you know, other people to take, you know, also come forward and, you know, be a part of this mission. But, you know, obviously it's hard to convince everyone to do so. You know, obviously people are scared, and but, you know, they're really, I mean, we are so appreciative of all the work that they do. They are, you know, really, they're just hardworking and, you know, dedicated for helping this community. And as somebody said, you know, this is our community too. We want to make sure if we are not in front of this, you know, it's going to be, we have to be in front of it. And the only way to do that is for everyone to be involved in, you know, in the screeners, you know, making sure everything is operating well, and protecting everyone as well.
All right, thank you so much to Commonwealth Healthcare Corporation CEO Esther Almunia. We also want to thank Marcus over in the KUAM newsroom on Guam for helping us with the live stream. And thank you all the viewers for tuning in. And we're going to have more for you tonight. And remember, tomorrow we'll be interviewing a U.S. Congressman for the NMI, Kilili Sablan. So we hope you tune in for that. Right now, reporting in Saipan, I'm Tomas Manglona for KUAM News.
Si Sus Masi.